Hello, everyone. My name is Sami Husseini. Today I'm presenting the case of Zoria Tierbag and psychiatric euthanasia. This case focuses on whether euthanasia should be considered for the patient whose suffering comes mainly from long-term mental illness instead of a terminal physical disease. My goal is to summarize the case, explain the legal and ethical issue, and give my recommendation to the committee. Zoria Tierbach was a young woman from the Netherlands who became part of the public discussion about psychiatric euthanasia. Her request was based on a long-term mental suffering, not a terminal physical illness. This makes the case difficult because her suffering was real and serious, but the psychiatric condition can sometimes change over time. The main ethical question is whether a competent adult should be allowed to choose euthanasia because of unbearable psychiatric suffering, or whether the doctor have a stronger duty to protect the patient from a reversible decision. Why is why this is an ethical dilemma? This case is true ethical dilemma because both sides are based on important values. On one side, autonomy supports respect in a patient's choice. If an adult understands the decision and continues to request it, euthanasia, their voice should matter. Beneficence, beneficence also supports relieving suffering. On the other side, non-maleficence means doctors should avoid harm. Euthanasia is permanent, and a psychiatric patient might improve later with treatment, support, or change in life circumstances. Justice also matters because patients with mental illness can be vulnerable and need protection. The legal framework. The legal framework depends on the country. In the Netherlands, euthanasia can be legal if a strict due care requirement are met. The request must be volunteer and carefully considered. The suffering must be unbearable with no prospect of improvement. An independent physician must be consulted. In the United States, the active euthanasia is now legal. Some states, like Oregon, allow medical aid in dying, but only for a competent adult with terminal illness expected to cause death within about 6 weeks. Canada also shows caution because people whose only condition is mental illness remain excluded by the MAID eligibility until 2027. We have the ethical framework. The ethical framework I would use is the principlism, because this case cannot be answered by only one principle. Autonomy is important, but uh, it can be the only factor. Beneficence ask whether euthanasia would be relieve suffering. Non-maleficence ask whether it can cause harm by ending a life that might improve later. Justice asks whether vulnerable psychiatric patients are being protected fairly. Uh, Fidelity also is important because physician can be honest, trustworthy, and loyal to the patient's best interest. The key ethical concerns. The most difficult issue is deciding whether psychiatric suffering truly is no reasonable chance of improving. Mental illness does not always follow a predictable course. A patient might suffer for many years, but later improve with a new treatment, environment, and supportive system. Another concern is decision-making capacity. The patient might understand the facts, but depression or hopelessness may affect how they see the future. There is also a tension between psychiatric euthanasia and suicide prevention. Healthcare providers usually work to prevent suicide, so it becomes difficult to know when a request should be respected or when it should be treated as a symptom of illness. Counter argument. The strongest counter argument is that psychiatric euthanasia should not be allowed because it can never be made safe enough. Mental illness can affect judgment, hope, and decision making. A patient may later become grateful that they survived a very dark period. Opponents are also Opponent also argued that approving euthanasia may make vulnerable patients feel like that as expected of them. This concern is important because patients with the mental illness may already feel isolated or like a burden. I understand this argument, but this is why I don't think psychiatric euthanasia should be approved quickly or treated like a normal medical option. My recommendation to the committee is that psychiatric euthanasia should only be considered in rare and careful review cases. It should not be approved quickly. The request should be voluntary and repeated over time, and made outside of a temporary crisis. The patient should be evaluated by more than one independent psychiatrist. The committee should confirm that a patient has decision-making capacity and is reasonable that reasonable treatment have always been attempted. Social issues such as loneliness, poverty, lack of housing, or poor access to care should be addressed first. My final position is that autonomy matters, but medicine also has a duty to protect vulnerable patients. Psychiatric euthanasia should only be considered when both compassion and safeguards are present. There are references I use for this case presentation. Thank you for listening, and I welcome any question from the committee. Have a good day.